Hello and welcome to the free Medicare video guide. Today we will be discussing Medicare. The discussion overview will be eligibility, what is Medicare, Medicare options, cost, and important dates and resources. First, we'll start with what is your situation? Are you in the current situation of not having any healthcare coverage, meaning no insurance? Or are you actively working, enrolled in a group health plan? Or are you retired, enrolled in a group plan, or have VA or veteran benefits or TRICARE? And also, one situation that is missing from this is maybe you're enrolled into a healthcare.gov plan. Next, what is Medicare? Medicare is the government's largest health insurance program, serving more than 60 million people, and it is run by CMS, or the Centers for Medicare and Medicaid Services, which is the Department of U.S. Health and Human Services. Also, the parts of Medicare, Part A and Part B, are Original Medicare, which we'll discuss in more detail. Also, Medicare Part C, known as Medicare Advantage plans, and Medicare Part D, known as prescription drug coverage. Next, we have here Medicare eligibility. So, who can enroll? Typically, people who are age 65, even if you're still working, or you may be able to qualify through a spouse if they've worked and you qualify for Medicare benefits. Also, you can receive if you've been receiving Social Security benefits for 24 months, on the 25th month, you're automatically enrolled into Medicare. Also, if you have certain conditions, for example, ESRD, end-stage renal disease, or Lou Gehrig's disease. Next, continuing, is the eligibility, which you had to have worked 10 years or 40 quarter hours to be qualified for Medicare by Social Security standard. Now, next we'll talk about the parts of Medicare. Starting with Part A, Medicare Part A, that's the hospital insurance. That's going to cover your hospitalization, skilled nursing facility, hospice care, and also some home health care. Next, you have Medicare Part B, that's your medical. That's going to cover things such as your doctor's visits, outpatient care, preventive services, occupational, physical therapies, and some home health care, just like Medicare Part A. Next, we have Medicare Part C, as in cat. That's going to be the Medicare Advantage plans. That covers everything that Medicare Part A and B covers, and also may include some additional benefits and services such as prescription drugs, dental, vision, hearing, as well as wellness programs, such as example, a gym membership. And then the last part we have over here is the Part D drug coverage, that is covering prescription drugs. Next, we have the two main parts, Medicare Part A and Medicare Part B, and also known as Original Medicare. Medicare Part A, that's going to be the hospital insurance. Now, normally there's no cost associated with Medicare, as long as you've qualified from Social Security standards, worked the 10 years or the 40 quarter hours. So there's typically no premium for Part A, but there is a deductible if you're hospitalized, and it's a per benefit period deductible. That deductible for the 2023 year is $1,600. So to give an example of that, let's say you're admitted into the hospital for a certain condition that's maybe catastrophic, or just being admitted into the hospital and have to be admitted and stay overnight, you'll be responsible for that $1,600. Now let's say you're in the hospital for 2 weeks and you're released from the hospital at the end of that second week, and you're out for a week, and let's say the following week you go back in to the hospital, you're still under that same benefit period. But once you have been released from the hospital and out of the hospital for 60 consecutive days, let's say you go back in the hospital on the 61 day, that deductible resets all over again, so you have to pay that $1,600 all over again. So you can see if you have a pretty rough year healthcare wise, those Part A deductible can become rather expensive. And also, this is taken into account if you just have that red, white, and blue Medicare card by itself and nothing else supplementing it. Now, we'll go over Medicare Part B. That's your medical. That's going to cover services such as the doctor's visits that we mentioned on the previous slide or page there. But Part B, you're going to have a monthly premium for that, and that monthly premium is $164.90. Also, there is an annual deductible. It's $226 for the 2023 years. So how that works is once you pay, of course, your monthly premium, and also pay or satisfy that annual deductible of the $226, then what happens is Medicare kicks in and pays 80% of your doctor's bill, and you're responsible for the remaining 20%. And that 20% is uncapped, meaning there's no limit on the amount of money that you'll have to spend. So, for example, if you get a doctor's bill in the mail for $100,000, you're on the hook for that $20,000. But we will look at options to protect yourself from the gaps that Medicare A and B does not cover. And those options are either option 1, Medicare Advantage plan, or option 2, a Medicare Supplement plan. Not to get them the two confused, they are two different options that you are able to enroll into. And we'll start with the Medicare Advantage option first. Medicare Advantage plans, how they work is they are network-based, meaning you'll have doctors and medical facilities that are in that network. They're copay driven, meaning you'll pay copay or co-insurances for services that you have rendered. And then lastly, the two most common plan types are an HMO or a PPO. HMO means in-network only. PPO, you have in and out-of-network coverage, but keep in mind that you'll pay a higher cost if you go outside the PPO plan's network. And those acronyms, if you're not familiar with, HMO, Health Maintenance Organization Plan, and then the PPO, Preferred Provider Organization Plans. And also, to give you an example of some of the costs associated with the Medicare Advantage plans, you'll pay $0 to $100 a month on plan premium. And then we have the second option, that is the Medicare Supplement plans, or also known as Medigap plans. These plans are standardized plans, meaning you have the same benefits and coverage no matter which insurance carrier or company that you go with. The only difference is the insurance company set the rates of those premiums. Next, you receive nationwide coverage, meaning you can go to any doctor or medical facility in the United States that accepts Medicare. And then lastly, it works with your Medicare Part A and B, meaning that your Medicare Part A and B is primary, and the Medicare Supplement plan is secondary. It's going to cover your deductibles, co-pays, and co-insurance. One point I want to also mention, going back to the Advantage plans, is you'll have the Advantage plan, it becomes the primary payer and not Medicare A and B when it comes to the Advantage plan. So I just want to go back and make a note of that. Okay, next, or last here, we have the prescription drug coverage, Medicare Part D, covering your prescription drugs. You can get coverage either through a standalone prescription drug plan that would supplement a Medicare Supplement plan, or you can receive it included in a Medicare Advantage plan. And the average national cost for the 2023 year is $43. And then next we have here, before we go with the times that the periods that you can enroll, I just want to go back and mention, so when you have the two options, Medicare Advantage or Medicare Supplement, both of them are great options. So which option you choose will depend on you. Mainly comes down to your budget and needs. So to give an example, if you maybe go to the doctor maybe once, twice, maybe 3 times a year, people tend to gravitate to the Medicare Advantage plan because it's a pay-as-you-go or as you use the plan, and you have that zero monthly premium or cost. Versus if you, let's say you go to the doctor more than 3 times a year, maybe you see a primary care specialist, primary care physician, also seeing a specialist throughout the year. You see those, doctors multiple times. People gravitate to a Medicare Supplement plan because they have the peace of mind of knowing that, hey, they pay that monthly premium and they'll receive little to no cost in the mail, and also giving that freedom and flexibility to choose. So next here we'll have, when are you eligible to enroll and when can you enroll? It's known as your initial enrollment period, or IEP. It takes place 3 months before your birthday month, and 3 months after your birthday month. So as mentioned, 3 months before your birthday month, that's when you can initially enroll into Medicare. And the way that you can enroll into Medicare is going to Medicare.gov or SSI.gov, or going to your nearest Social Security office to speak with a case manager worker to enroll into Medicare. And some important dates. The AEP, this is the annual election period. This takes place every year between October 15th and December 7th. So it's not that you have to be, when you're first initially enrolled into a plan, that you have to stay enrolled in it. You'll have a time of the year that you can make changes. And usually that's, specifically for the Medicare Part C or the Advantage plans or the prescription drug plans, not so much for the supplement plans, because the Medicare supplement plans, you can enroll into them at any time throughout the year. But when it comes to the Advantage plans, Medicare Part C or standalone prescription drug plans, you're able to change those plans during that time and have a start date of January 1 of the following year. Also, there's an SEP, or certain times of the year that you are able to enroll into a Medicare health plan, or you may have to change your Medicare health plan. That is the special enrollment period. So what would qualify for this? Let's say you move out of your service plans area. Let's say you move from Massachusetts down to Charlotte, North Carolina. Then you would have to have a special enrollment of 60 days or 2 months to enroll into a new health plan in your area. Also, not so much for the supplement plans. Of course, you can enroll into, let's say you've enrolled into a Massachusetts supplement plan, you want to enroll into a North Carolina supplement plan, you're able to do so, or you're able to keep that supplement plan. But definitely when it comes to the Advantage plans, Part C, those plans are designed by zip code and county, so you definitely want to make sure you enroll into a new plan in your new service area. And next here we have the resources. So as mentioned, Medicare.gov, you can go here, create an account to enroll into Medicare or find information about Medicare. And also there's the number that's provided here as well, the 1-800-633-4227. And then next here you have the SSI, SocialSecurity.gov, so you can enroll into Medicare here as well. And also you can reach out to Social Security by calling 1-800-772-1213. And then here I just want to kind of mention some other resources, extra help. You may qualify for that, to where you can receive help paying for prescription drugs, and that is income resource based. And also Medicaid, based off your state, you can receive state help to help with the cost share of paying for co-pays, co-insurance, and deductibles with your Medicare health plan. And then next, I just want to mention the insurance companies or carriers that we represent most of the insurance carriers in the states that we represent. Of course, some of the major carriers. And then the next is the next step will be contacting us. And here during this process, then we'll be able to compare options in your area, the Medicare Advantage plans versus the Medicare Supplement plans in your area. Also, we have tools to look up your doctors, and we confirm that your doctors are on the plan's network, as well as the medical facilities. And we can look up any medications or prescriptions, having a list of drugs that will be covered under your drug plan, because those plans have what's called a formulary, a list of drugs that they cover and do not cover, although they do cover up to 2 drugs in each therapeutic category. But we just want to make sure that you're enrolling into the best plan that fits your needs and budget. So to contact us, you can definitely go to www.vhlins.com. Also contact us on this number, 704-315-4730. You can also text as well to call to set up an appointment. And also you can definitely email at info@vhlins.com for more information, or as once again to reach out and talk to us. So with that will do it for the Medicare 101, or the free Medicare guide. I appreciate you guys' time, and feel free at any time to go back if to go over anything, or also reach out with any additional questions. Thank you, and have a great day.